We need to have more conversations around stigma and implicit bias, especially at a stage where we've accelerated our efforts to end the HIV epidemic so much, yet we still find ourselves so far away from eliminating and eradicating HIV.
Since the start of HIV in the early 1980s, the communities that have been most affected by HIV have the ones been most ostracized. So for example, gay men, gay, bisexual, and other men who have sex with men. We're talking about sex workers, persons who inject drugs. And then continuing on to today, we're still seeing communities don't want to discuss or talk about or really engage in the ways that we prevent the spread of HIV for these communities because of the stigmatizing nature of HIV. 3 levels of stigma that we see are at the institutional level, the community level, and the interpersonal level, or the personal level itself too. So at the institutional level, you see stigma really show itself in laws, policies, procedures that reduce and prevent certain resources going best to different communities in need.
Community level stigma can be defined as prejudices, stereotypes, or beliefs that an entire group of people hold towards an individual or a group of individuals that might have a specific characteristic. It can be their HIV status, but it can also be their race, their ethnicity, the language they speak, or the country they're from.
When you talk about individual stigma, you're talking about the internal person. They start to believe the things that they're actually hearing about themselves.
Stigma and implicit bias manifests itself in a variety of ways to hinder people's access to care. Some examples of that could be shame that people might experience, either within themselves or from other individuals, to actually have conversations around their sexual health practices with their primary care providers. It could be fear that they have of being judged, so they won't go out and get tested and avoid a diagnosis. Or it could be fear of disclosure of their HIV status once they have a diagnosis to their partners, to their families, and to their friends, because they don't want to feel ostracized from their in-network or their in-group.
The way stigma manifests itself, you can see it just in looking at the level of inequity that exists within our society. You have people of color who are experiencing significant health inequities, and that is a direct result of the stigma and the ongoing burden that's being placed on them each and every day. Stigma, is literally killing people because it forces people into a level of isolation that's just not sustainable.
One of the big problems we have with stigma is that it's constantly being reinforced by implicit bias. And what implicit bias really is are these internalized prejudices, attitudes, or beliefs that we have towards a certain group of people or towards an individual that we don't really know that we have. So a lot of people don't consider themselves racist, but they might act differently towards a group of people or a person without even realizing it.
Implicit bias and stigma prevents individual from getting adequate care because it discourages them from wanting to seek that. The way in which they are treated, going into a clinic visit will really make or break whether or not they're going to return. And what's so unfortunate about that is that, it keeps people unhealthy. It keeps people sick, and in the end, sometimes it kills people, because we're not willing, to check our environments and make sure that those environments are fostering a welcoming and affirming environment, to folks.
We need to fund stigma reduction programs because of how valuable they are in the response to HIV. We know that stigma is one of the leading reasons why people do not get HIV tested. They do not seek treatment if they are themselves positive. Knowing this, we need to make sure that those barriers that are in place because of stigma and discrimination are removed.
Health departments and community-based organizations can take a variety of steps to help have conversations around stigma and address implicit bias. A few examples of these might be cultural responsiveness trainings within the health department for staff or leadership. It can be creating affirming spaces through signage and appropriate language. But it can also be providing services outside of normal working hours, weekend clinics, mobile clinics, or after-hours clinics.
It is the mission of public health to serve a public good, and in order for us to fulfill that mission, it is our responsibility, to address stigma and implicit bias.
There's no way of ending the HIV epidemic without addressing stigma. By making sure that making sure health facilities are welcoming and engaging of communities is the only way you're going to fully be able to find everyone living with HIV in the United States, as well as be actually able to get them on treatment and continuous treatment and care for the rest of their lives.